Hi, new family. Thank you so much for allowing me to be a part of this birthing process and to continue to help you heal and have your family grow during the postpartum period. It's really been an honor. What's really important now in this time, Mama, is that you are in bed resting with your baby skin to skin, and really taking this time to heal. I showed you your placenta. You know, it's about this round. You have a wound healing inside of you that's this big. If it was outside of you, people would be really nurturing you and tending to you, and they will be anyway. But that's something to really remember, is that your body is going through massive transition and healing, and bonding with your baby is so crucial at this time. So you're going to be experiencing some bleeding. Some blood clots may pass. If they're larger than a golf ball, please let me know. And if you saturate and bleed through 2 large pads within an hour, please also call me. If you notice a foul smell coming from your vagina, that's another indication to call. And your bleeding will turn brown after a few days, maybe a week, and then turn into a yellowish, white, or clear discharge. And by the end of 6 weeks, you should be done bleeding. Your uterus is slowly shrinking back to its pre-pregnancy size, and it should always feel nice and firm, like a big, large grapefruit. The top of your uterus, you should be able to feel it below your belly button. And again, remembering that nice, firm grapefruit size. And around day 10, your uterus should be below the pubic bone. And of course, I'm coming to check in on you during this time period to make sure all of that's happening as it should be. You may be experiencing after pains or cramping after the birth. You can use a hot compress to help alleviate those pains. Arnica is also great. I'm also going to recommend that you do some sitz baths with the herbs I've provided for you. That will also be helpful. Again, if you're noticing a foul smell coming from your vagina, definitely let me know. Also, if you have flu-like symptoms or a fever over 100.4, that's definitely a reason to call me, as well as excessive night sweating. Your bottom, I'm sure, is very sore. I provided some witch hazel and aloe pads in the freezer for you to use, along with these ice packs. You may not want to use cold or ice on your bottom for longer than 24 hours. Just be cautious not to over ice. And you can also take Tylenol or ibuprofen for the pain. And if it's unbearable, please call me. Urination. I've gotten you up to pee already, so that's great. What can help with the burning sensation is using the Peri bottle and squirting it as you urinate. That helps dilute the urine. And if you're unable to empty your bladder, please call me. Also, first 24 hours, when you get up to go anywhere, which will only be to the bathroom because you're resting, make sure somebody is with you just in case you start to feel faint. So even if it's the middle of the night, wake up hubby, tell him you gotta pee, and have him escort you to the restroom. It may take a little while for a bowel movement to come, about 2 or 3 days. If it takes longer, again, let me know. And again, I will be seeing you tomorrow so we can check in about this. What helps with bowel movements is eating a lot of really nice, nourishing foods, cold-pressed oils, flaxseed, using a stool to use the bathroom so that your knees are elevated. Get lots of fresh fruits and vegetables. Are really helpful. If you have hemorrhoids, you can saturate a cotton ball with witch hazel, tuck them into the anus, allow them to pass with a bowel movement, and then repeat the process until they're gone. Also, sitting on a donut pillow can be really, really helpful. Breastfeeding seems to be going really, really good. I see you and baby have a nice latch. Make sure you're feeding on demand. Babies tend to want to be on the breast longer than we may think that they should be, but allow your baby to be fully up in this area. Remember all the latch details. Baby wants to have a nice big open mouth. Plop it on the nipple. Good to go. Engorgement might happen when your milk comes in around day 2 to 4. Your breast may get really, really full. Hot compresses are great for this. Also, cold cabbage leaves in your bra can provide a lot of relief. And feeding the baby on demand is really helpful. If you notice lumps in your breast or possibly clogged milk ducts, please let me know. Along with if your nipples are bleeding, sore, or cracked, I can definitely help you address those things. It shouldn't be so painful. Lots of self-care, plenty of rest, take baths, nap with the baby, sleep when the baby sleeps, and really just take this time to enjoy your newborn. As for the baby, the temperature should be between 97 to 98, maybe even 99 degrees. If your baby's temperature is outside of this range, please give me a call or go to the emergency room. Newborns normally breathe 40 to 60 breaths a minute. About 30 to 50 breaths a minute. If there's rapid breathing, extreme crying episodes, if the baby's nostrils are flaring, if it's grunting, if your baby is turning blue, if you can see the chest wall of the baby as it inhales, definitely call me or 911. Your baby already pooped, which is great. We normally want to see urine and stool passed at least once within the first 24 hours. As you saw, the baby's poop, the first poop meconium is very thick and tarry. By the second day, it'll be a thinner green, and then it'll become very yellow and loose. Again, I'm going to be checking in with you postpartum, but your baby should have 6 to 8 wet diapers a day and 3 to 5 bowel movements a day. And that helps us ensure proper weight gain and growth. Don't touch the umbilical cord. You don't need to do anything. Just make sure it gets lots of air and isn't staying too moist. It should fall off in about a week to 10 days or so. If it has an unpleasant odor, is bleeding, or is swollen and red, please let me know. Make sure you're drinking lots and lots of water, about at least a cup every time you're feeding. And feedings are about every 2 to 3 hours. Try not to go longer than 4 hours without feeding. And a nursing session lasts about 20 minutes. Sometimes a little shorter, sometimes a little longer. Again, skin to skin with your baby and feed on demand. You're co-sleeping, which is really, really great. Having the baby on your chest is perfect, and try to keep the baby on a firm, flat surface on its back while sleeping. Also, I'm going to be assessing your baby for jaundice, and you can keep an eye out for it too. It's a yellowing of the eyes and skin. If you notice this, please let me know. Also, exposing your baby to sunlight is really, really important and beneficial to prevent jaundice. So even if it's inside and you're by a window, the sunlight exposure is still really helpful. And then tomorrow I'm going to come back. We can talk about the newborn screen, if you so desire to have that done, and we can figure out the birth certificate details. And again, congratulations. I'm so happy for you and honored to be a part of this process.